to the Patient Educators Update, where we talk about patient education in a clinical environment. Our guest today, as always, is Fran London. Hi, Fran.
Hi, Chuck.
For those of you that may not know, Fran is currently the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona. And she's also the author of the book, No Time to Teach. And you can find that book at bookstores and online at Amazon and other places. And that book was voted the 2010 Book of the Year by the was American Journal of Nursing. Is that correct?
That's right.
Yeah. So Fran is our resident expert, and we're going to talk today about using interpreters with patient education. This is one of those topics that may not be bandied about very much, but we know that in pretty much every hospital in the U.S., this can be an issue with so many different folks coming in from different countries and taking up residency, and also those who are just vacationing who just happen to get sick. So the first question I would have for you today, Fran, is when should you use an interpreter?
Anytime you're talking to somebody who doesn't speak your language. The issue really is that even if they speak some English, they probably don't have a handle on the medical stuff. And when you're stressed and if you're diagnosed with something or you've got symptoms, you really understand better in your native language.
Yeah.
So it really would be helpful.
Yeah, that makes sense. Now, one question I would have from my personal experiences, I know that in speaking with folks that speak a different language than I do, a lot of times when you ask them questions, they just kind of nod their head and go, yes. And if you think they're understanding you, you're probably mistaken. So is it a good idea to kind of do some kind of checking to, you know, before you bring in the interpreter, if they say, yes, I speak English, but...
Yeah, you should have a conversation with them.
Okay.
And get a sense of... and the question really is, would you be more comfortable if we could have this conversation in your language? And another thing you need to stress in the beginning is that the interpreter will keep the information confidential, because they might not want an interpreter if they think, you know, something about their STD is going to be spread around
Sure.
the neighborhood.
Yeah. And now let's talk about how you work with the interpreter and the patient. If you're in a big facility, you may have access to interpreters in the hospital, but if you're in a small facility, you may not. Can you do this over the phone or on a teleconference or something like that?
Oh yeah, oh yeah. There are companies that sell interpreting services over telephones. One of the ones I know about is Ceracom, but I'm sure there are others. And that really can help access when you're in a rural area or you have a small facility, and it doesn't make sense to hire a full-time interpreter.
Okay, and I would imagine since they're a company, they have access to potentially 20, 30, 40, 50 different languages or more that
Yes.
you can call upon.
Yeah, some rare languages you might have to make an appointment to make sure you have, but for all the really common languages, they can get someone for you immediately.
Okay. Now, what about the hospital that maybe doesn't use a service, but they use maybe somebody that's on staff that maybe is a technician or a nurse or something like that? Do you do that at your hospital, where you just bring anybody that speaks the language in to be an interpreter?
At Phoenix Children's Hospital, we actually have a program where we kind of internally certify interpreters.
Okay.
The SBA program. So we test them, we give them classes in medical terminology, we teach them how to interpret. There are certain rules of interpretation, like make sure you say everything, don't leave anything out. So they get the training first, so that we then have a list where if there's no regular interpreter available when you need it immediately, you can call on one of these trained people who might be, you know, a clerk or a transportation person or whoever who is bilingual.
Okay, so you guys run a certification program to make sure that the ones that you have in-house are qualified to do what they need to do, and they understand what they need to do.
Yes.
Okay, that makes a lot of sense. I don't know if every hospital does that or not, but it certainly can bring some validity to the program.
And just as an aside, our hospital will certify for other hospitals their people. So if there's a small rural hospital in Arizona that wants to send a couple of people to our program, we will put them through.
Oh, okay, that's interesting. Well, let's talk a little bit about how you deal with the interpreter and the patient. As the nurse educator, do you talk to the interpreter or do you talk to the patient in terms of eye contact and gestures and things of that nature?
Ah, good question. The best way to do it, obviously, is to talk directly to the patient and have the interpreter somewhere on the side. So you're looking at the patient, you're asking the questions in English, and the interpreter is saying the things you're saying, repeating them in the other person's language. And you have to phrase things like you're having a regular conversation. Instead of saying to the interpreter, ask her how she's feeling today, you actually say, how are you feeling today? And that's what the interpreter says.
Okay, so there's no tell her this, tell her that. You're actually doing if you were doing it in English, you're speaking the way you want the message to be heard, and then the interpreter has to do it that same way.
Exactly.
Okay. How does the use of medical jargon and some of the big long words that certain diagnoses are, how does that fit into this? Is there a translation for all of these scientific terms?
Not always. I mean, first of all, the interpreter may not know them, but second of all, they may not have exact words, and it might not even be medical terms. There might just be concepts that an interpreter would have to use, like a full sentence to describe what it is you mean in one word, because English actually has a lot of words that are very complex.
Okay.
In that way.
Okay. Would you have a conversation separately with the interpreter, either before the meeting with the patient or even during the meeting with the patient, where you discuss how to position this if there's not a word or a phrase that does it?
There should always be a conversation before you start the conversation with the patient, with the interpreter, to talk about how you're going to deal with things.
Okay.
Remind the interpreter you want everything you say to be interpreted, that if there's any questions, they should ask you. If they need you to slow down, maybe have a hand signal so that it's good for you to speak in short sentences, not necessarily simpler sentences than you would use with an English-speaking patient, but certainly shorter sentences so that the interpreter has time to hear the whole sentence and say it.
Okay, so from a phrasing standpoint, shorter sentences in order to make it easy for the flow of communication.
Yeah.
Okay.
And then work with the interpreter before the meeting to talk about how you're going to deal with, if there's a term that the interpreter doesn't understand, it's okay to ask, what does that mean? So you can explain it, and then it can be explained to the patient clearly.
Okay. How would you do Teachback with an interpreter?
Exactly the same way you do it with an English-speaking patient.
Okay.
So one thing is to pay attention to the nonverbal cues. So watch the patient's responses to things so that you know when to ask for a Teachback. So if there looks like there's some confusion or misinterpretation, that's when you stop and say, okay, now tell me what you understand at this point, or how would you explain that too? And then get them to say it in their own words to make sure that they've gotten it correctly.
And it makes sense that the thing you don't want to do is ask a lot of closed-in questions where their response is yes or no, because you may not get the right answer back.